Well, welcome everyone. It's my delight to be here with all of you for this second in the 6-month series of Living with Dementia, the Roadmap. Today, we are delighted to be focusing on evaluation and education. What does a diagnosis mean? How do I find help and a resource? But first, a little bit about the roadmap. For the past 2 years, the Dementia Friendly Baltimore County leadership team has worked hard to pull together dementia resources that are pretty dispersed, to pull them together in one place to help all of us navigate the dementia journey. While we know it's unique for each person, we also know that there's twists and turns and there are similarities in terms of the way that we all will most likely encounter. But what do we do along the journey? We need resources to help us discern how to make choices, to help us identify what our options are. So we started with last month looking at understanding memory changes. And we had Stacy Young from Broadmead talk about that uh, benchmark, that choice point, really the threshold where we enter the dementia journey as individuals living with cognitive challenges and also care partners, caregivers. Today, we will focus on the first real benchmark in the map, and you can see it here on the screen, evaluation and education. Next month, we will look at adjustment and support at home. So as you can see, each month through October, we will focus on each bench, or we're calling it benchmark or a choice point. Um, on the map, which is available in hard copy, but also an electronic copy, there is a QR code and a link that you can click on that drops you into a database with key resources to help you discern what to do in that point in your dementia journey, but also to help you plan for the next point. So even if you may not be far along in the dementia journey, you may want to look up, you may want to check out some of the benches to see some of the resources that can help inform your decisions along this path. The dementia path also has a checklist that can help guide you. And so reach out to us if you would like hard copies of this dementia map. Be sure to join us for future sessions. This session is recorded and all the sessions will be found. You can find them later on the Department of Aging YouTube as well. Finally, in terms of contacting us, you can always reach out to me at Dementia Friendly at baltimorecountymd.gov for more dementia resources and to further help you navigate the dementia journey. So, without further ado, it's my pleasure to introduce my dear colleague, uh, Kristi Mroz. She's a dedicated professional specializing in dementia care and caregiver support. She is a program manager for the Alzheimer's Association of Greater Maryland chapter. She supports initiatives focused on caregiver education, volunteer recruitment, and community partnership development. Kristi's role involves building and nurturing relationships with diverse community partners to advance the association's mission. And we are delighted to have Kristi as one of our key Dementia Friendly Baltimore County leadership members. And so, without further ado, Kristi, I turn it over to you. And I thank you for joining us today with your expertise and your support.
Thank you. Thank you so much, Emily. And I'm really excited to be here today. And thank you all for joining us this morning. As Emily said, this is our second presentation in our roadmap series designed by Dementia Friendly Baltimore County leadership team to provide information, support, guidance to all those on the dementia journey. So today we're highlighting evaluation and education, what you'll see referred to as bench one in our map. So I always like to start off by kind of level setting on what we mean when we use the terms dementia and Alzheimer's, because I think the most common question that I receive when I'm out in the community is what's the difference between Alzheimer's and dementia? So we like to refer to dementia as an umbrella term. Dementia describes a group of symptoms associated with a decline in memory, reasoning, or other thinking skills that is severe enough to interfere with daily life. It's not a normal part of aging. It's caused by damage to the brain cells that affect their ability to communicate, which can then affect thinking, behavior, and feelings. And while there are plenty of types of dementia, Alzheimer's accounts for up to 80% of all dementias. It's also important to recognize that it is possible to have mixed dementia. So a person can have more than one type of dementia. Like, for example, someone might have Alzheimer's and vascular dementia. So, while many people experience some changes in memory, thinking, and behavior as they age, again, dementia itself is not a normal part of aging. So, those cognitive changes that disrupt daily life are not typical. So, if you or someone you know is experiencing memory or thinking problems, it's really important to share those concerns with your doctor. Only a full medical evaluation conducted by a physician can determine if symptoms are, in fact, related to dementia. So I want to talk a bit about that evaluation piece and what types of physicians might be able to help you with a diagnosis if you have some concerns. So, primary care physician, people often first discuss their memory or thinking concerns with their primary care doctor, which is a great first step. They're trained in general internal medicine or family medicine. They focus on diagnosing and treating common medical conditions. They can perform initial assessment and full evaluation, but many might also refer you to a specialist to confirm a diagnosis if there are suspicions, and maybe a specialist to help determine what type of dementia there might be. So, when talking to your primary care physician about memory and thinking problems, maybe ask them how familiar they are with diagnosing dementia, and whether there are maybe some circumstances in which they would refer you to a specialist. One recommendation that I give people is to establish a baseline cognitive assessment with your primary care doctor. So even if you're not having any memory concerns right now, it's good to go have that baseline at your annual visit. So then a year, 2, 3 years down the road, they can continue to reevaluate and might be able to better identify, yeah, there has been a change in the last couple of years. These are some of the specialists that primary care might want to refer you to if necessary. So specialists can evaluate memory and thinking issues and diagnose dementia. Some people maybe with unclear symptoms, including people under age 65, might require evaluation by two or more specialists who kind of combine their findings to reach a diagnosis. So geriatricians, they're primary care physicians who have additional training specializing in medical care for diseases and conditions common among older adults, so generally people over 65. These physicians are typically prepared to manage multiple medical conditions. Geriatric psychiatrists are trained in general psychiatry with additional training in mental health and aging. So they may be helpful in ruling out other causes of memory loss, such as depression, and in treating dementia-related behaviors in people living with dementia. Neurologists are trained in nervous system disorders, including issues with the brain, spinal cord, peripheral nerves. They might typically receive formal training in Alzheimer's and other dementias, although not all diagnose or treat people living with that. Some neurologists might focus on other conditions such as pain management, Parkinson's, seizure disorders. So if you do get referred to a neurologist, just inquire with them if they do treat individuals living with Alzheimer's or other dementias. So really be an advocate for yourself. Don't be afraid to ask questions. Neuropsychologists administer a variety of tests to assess thinking abilities, including memory, attention, language, reading, problem-solving skills. They work closely with other specialists, including your primary care doctor, during the diagnostic process. So most practicing clinical neuropsychologists have like a PhD or a PsyD in clinical psychology and some additional training in neuropsychology. And then, of course, there's dementia diagnostic centers or disease research centers. So they generally have at least two types of specialists as part of their medical team who can diagnose and treat dementia. usually funded by the National Institute on Aging, and some dementia diagnostic centers are involved in research and can maybe suggest ways to participate in clinical studies if that were something that was of interest to you. So, more on that evaluating memory and thinking problems. So, you've picked a doctor, now what to expect? Your doctor will likely take multiple steps in order to evaluate your memory and thinking. The evaluation may be divided into several visits, allowing time to gather information to accurately determine the cause of your concerns and rule out other possibilities. So, understanding the type and purpose of the tests that your doctor might order and knowing what to expect during an evaluation can really be empowering and it can help ease your anxiety. So, again, don't be afraid to advocate for yourself. Don't be afraid to ask questions. So lab tests are some of the exams that might be ordered, blood work to check for any vitamin deficiency, thyroid hormone concerns, rule out infection, check how liver and kidneys are functioning, because all that can affect our brains as well. Urinalysis, the doctor might request a urine sample to screen for infection, assess kidney function, because we've seen in older adults that UTIs or frequent UTIs can cause symptoms that look like dementia. It can cause some heavy confusion. Cerebrospinal fluid analysis, in some cases where maybe some additional information is needed, the doctor might order this, which is where they take a sample via a spinal tap. And then, of course, the mental health and cognitive status tests, always a depression screening. I think this is, at least even for my generation, I'm seeing this seems to be a common part of like any physician office you visit now, which I love to see. So your doctor might ask you questions to determine if you have any symptoms of depression because it can cause memory and thinking problems. It can interfere with your day-to-day living. Mental cognitive status tests. So these tests are used to evaluate your memory, your problem solving skills, and other thinking skills. Some of them are very brief. You might be asked about the date, the time, remember lists of short words, or asked to do simple math calculations, draw a clock. And other tests can involve more time and more complex problem solving. Some doctors may ask you to participate in a more comprehensive evaluation known as a neuropsychological exam, which uses multiple tests and evaluates many different cognitive areas, including executive function, judgment, attention, and language. And then brain imaging, of course. Imaging technology is used to evaluate the structure of the brain and look for any changes in the brain. So they're looking for those plaques that can form when somebody does have Alzheimer's. So CT scans or MRIs, again, used to see the structure of the brain. They can show brain shrinkage. They can rule out conditions that might cause similar symptoms to Alzheimer's, but that require different treatment. Like, as you can see listed, things like brain tumor, aneurysm, bleeding in the brain, stroke, buildup of fluid. An MRI scan yields higher resolution images and usually takes a bit longer than a CT scan. And then there's PET scans and SPECT scans used to evaluate brain function. In both, they use a radioactive tracer injected into the bloodstream. Analyzing movement of that helps them to evaluate the functions such as blood flow in the brain or the brain's use of glucose. So when all of that testing is said and done and there's potentially a diagnosis, what does that mean? Being diagnosed with Alzheimer's or any type of dementia is life-changing, but we want people to know that you are not alone on your journey. It is very normal to experience a range of emotions, and acknowledging those feelings can be a really important first step in preparing for the changes ahead. So you notice symptoms, you made the appointment, you took the tests, you start to feel this roller coaster of emotions, right? Fear, hope, despair, denial. You get a diagnosis, you might feel a little unsure of how to respond or where to turn. Um, it can be really frightening, but again, we want people to know that there are resources available. And these are some of the emotions that people might feel. And not only as somebody living with a diagnosis, but this can be really scary for caregivers too, and family members and friends. Um, your life's changing in ways you didn't expect, and you can't control the course of the disease all the time, so you're feeling a lot of anger, but also maybe some relief because you've had these symptoms and suspicions and now they've been confirmed. um, Also denial because the diagnosis is hard to believe. It can be overwhelming, thinking about how your life might change over the next couple of years. Depression, there can be a deep sadness. People sometimes lose interest in things that maybe they once enjoyed. You can feel the struggle to find hope for the future. Resentment, you might be asking yourself, what happened? What did I do to deserve this? Why is this happening to me? How could I have done this? Fear. So there's a lot of worry about the future. How is my family going to be affected? Who's going to take care of me? Or maybe you're a caregiver yourself and you're getting a diagnosis. So then it's, what about my loved one who I'm caring for? Um, you can feel a little isolated. So, maybe you just feel like no one really understands what you're going through, or even feeling like you're being a burden and you're not wanting to be around people, not wanting to socialize. So you might start to pull away, and then a sense of loss. So it can be really difficult to accept this change in your ability. But acknowledging your feelings is a really important step, again, in preparing for the changes ahead. So, what resources are available? As I talked about, being diagnosed is an overwhelming event for both the individual receiving the news as well as for those around them. All of a sudden, the future feels finite. There's this adjustment to this new reality is accompanied by so many questions in regards to how this diagnosis will affect day-to-day life, how to plan for care, what resources are available. So again, it might feel isolating. It's really essential to remember that no one is alone on this journey. The state of Maryland, the federal government, nonprofit organizations. We offer a variety of financial, material, and legal assistance for people affected with dementia. Um, Maryland Access Point MAP specialists work with caregivers, professionals, and all individuals with long-term care needs to help plan, identify, connect, and assist with accessing private and public resources for um, long-term care services and supports. Um, and that might include information on transportation, income, financial aid, senior and community centers, different clubs, nutrition, meals, pharmacy assistance, housing, volunteer opportunities, and the list is endless. So, again, maybe you want to start by reading a little bit about Alzheimer's and dementia, what to expect on the journey. So you can always find books about the disease. If you're a caregiver, there are a lot of wonderful books on caregiving written by caregivers. Um, you can visit the Alzheimer's Association website, alz.org. Call the 24/7 helpline. We have a 24/7 helpline at 1-800-272-3900 to help you find local support and resources, like support groups maybe for caregivers or for people who are newly diagnosed. And again, Maryland Access Point is such a great place to start. I have the Baltimore County number on the screen here, but if you're not in Baltimore County, you can find the number for your local county if you Google it. And then baltimorecounty.md.gov / Baltimore or / dementia friendly for additional guidance. And I'm going to show that map one more time that Emily had up on the screen. So again, this is the map that was designed by Dementia Friendly Baltimore County's leadership team. So this is the newest resource, what we call our Living with Dementia Roadmap. So it's organized to guide those living with dementia and their care partners through the journey. It's filled with, if you go to the website, you can even scan these QR codes and it's going to bring you to different information and videos about each topic, which you can find all on the Baltimore County government website. It's filled with videos and so many links to many valuable resources about all of these topics. You might also view the Accessible Living with Dementia Roadmap brochure for more information. And Emily said that you could, if you want any physical brochures, you can get them through her. But I really highly recommend you visit these different benchmarks. And I'll talk a little bit later too about the other upcoming education programs, and I'll put the dates up on the screen so that you can maybe snap a picture or write those down so that you can hopefully attend. Um, and again, scan these QR codes if you want any additional information. And I'm going to share a little bit more about planning for care costs. So now, there is a diagnosis. What do we do? Where do we turn? It's really, really important to talk about finances and future care wishes soon after a diagnosis, especially if someone is still able to participate in those conversations. It's really important to have those early on so that individuals can make their wishes known. You want to organize and review important documents. You know, some people might create an advance directive or a living will, and then they don't update it for years and years. It might still have some people who have passed or who they're just not in touch with any longer on the document. So it's really important to keep those updated. Get help from well-qualified financial and legal advisors. So maybe talk to a financial planner, a estate planning attorney. You just want to make sure that you've got all financial considerations accounted for, and estimate possible costs for the entire disease process. You know, do you have family and friends who might provide care in the future? Is that something that you might need to hire help for? Do you have the funds for that? Do you need to consider maybe a continuing care retirement community or memory care? These are all things that are important discussions. Look at all of your insurance options. Find out which government programs you might be eligible for, tax breaks you might qualify for, and explore different financial assistance that you can personally provide, and take advantage of low cost and free community services. So again, on that on the roadmap site through the Baltimore County government site, you're going to find links for maybe a free advance directive through the Maryland Attorney General. You can again call Maryland Access Point if you have specific questions or need some guidance on, you know, who do I turn to, or do you have any suggestions on who I can call? Not only Maryland Access Point, but that Alzheimer's Association 24/7 helpline can also share that information with you. You can find elder law attorneys near you through either one of those numbers. Senior legal assistance at maryland.gov. You can look for free legal services for Maryland senior citizens. Free civil legal services available for financially eligible Maryland seniors by contacting Maryland Legal Aid. I see someone put in the chat, yep, veterans benefits, also excellent to look into for and some long-term care insurance. So those are just some of the key tips for planning for care costs. But again, I think the most important thing is to just make sure you're having those discussions. We know that they can be really uncomfortable. Nobody loves talking about money, but again, for the benefit of everyone involved, it's really incredibly important to just approach the topic in as sensitive a way as you can. And why is early detection and diagnosis so important? It is essential to providing access to information, to care and support, not only to people living with Alzheimer's or another dementia, but their caregivers as well. Many people who are living with Alzheimer's don't even have a diagnosis. And among those who are diagnosed or who are living with it, some of them are even unaware of their diagnosis. Maybe they've been excluded in those conversations. But an early diagnosis can improve the quality of care and quality of life and may reduce the financial and emotional impact of the disease. Um, so it can really allow individuals with the disease and their caregivers to better manage maybe medications. It can help them build a care team, manage comorbidities, receive counseling, support, whatever they're looking for. Even enrolling in clinical trials, addressing driving and different safety concerns. It can also mean eligibility for new treatments that are out there that have been shown to slow the progression, which means more time and more memories for that person. So, just quickly to touch on those new treatments that I just mentioned, we have come a long way since Alzheimer's disease was first described in 1906. Not until 1996 did we see the first treatments for symptoms, such as Aricept, Namenda. Those are some of the most common treatments for symptoms right there. But there is, and then in the last few years, the FDA approved the latest medications that have been shown to slow the progression of Alzheimer's. They're really beneficial to people who are in the early stages of the disease. And that's really when you're eligible to have to take those medications. So that is why early detection and early diagnosis is so important. Because if there is no diagnosis, and somebody is, in the mid to late stages, they're then not going to be a candidate for these newer drugs that are on the market if that were something they were interested in. So again, until 2021, the only treatments that were available focused on the symptoms of Alzheimer's, so the behaviors. It's because people started participating in research and clinical trials that the FDA approved these first few medications that have been shown to slow the progression in its earliest stage again. Aduhelm has been discontinued by the manufacturer Biogen, not because it wasn't working, but because they chose to put their funds elsewhere. But the two that are still on the market, Leqembi and Kisunla. So beta amyloid is the protein that collects on the brain and forms the plaques when someone has Alzheimer's. And drugs like Leqembi and Kisunla are anti-amyloid drugs that connect the plaques and help remove them from the brain. So these really change the course of the disease in a meaningful way for people in those early stages, giving them, again, more time to participate in daily life and live independently. So again, come a long way. 25 years ago, we had no idea this was where we would be today, and hopefully treatments continue to evolve in the future, leading to better outcomes. I also want to just touch briefly on some facts and figures that recently came out so you can really understand the depth of Alzheimer's, the amount of money it's costing, how many people are diagnosed, how common it is. I think everybody knows somebody who's affected by this in one way or another. So each year, the Alzheimer's Association releases what we call a facts and figures report, and these are just some of the key takeaways. There are an estimated 7.2 million Americans living with Alzheimer's. That's huge. Deaths due to Alzheimer's more than doubled between 2000 and 2022. So that's a 142% increase, when during that same time period, deaths from heart disease actually decreased, which is excellent. Nearly 12 million Americans provided more than 19 billion hours of unpaid care, valued at $413 billion. And with the number of people living with Alzheimer's expected to rise, those numbers are, of course, expected to rise too. And those are family caregivers. Those are, again, unpaid caregivers, people who are caring for their loved ones at home. More specific to Maryland, there are over 127,000 people aged 65 and older living with Alzheimer's. There are 258,000 caregivers, and you can see many of those caregivers are reporting that they have their own chronic health conditions, they're feeling depressed, or have a diagnosis of depression, they're in poor physical health. So this is really challenging for caregivers as well. That's why not only is it important to know the supports that are available for somebody living with, but also for caregivers as well. Those caregiver support groups are are incredible because you will find people who are on a similar journey, and that's going to help with that depression and anxiety that you might be feeling. You know, being able to talk about that is really important. Um, and then you can see some additional statistics there. About 4,000 people in hospice care with a primary diagnosis of dementia. And then you can see the high costs for people in healthcare who are living with dementia. So I want to share our vision, a world without Alzheimer's and all other dementia. I think that's something that everybody can get behind. And I hope you walk away from this presentation having learned something that you can use or something that you can share with someone who can use it. I want to again bring attention to the other upcoming programs we have. So if you want to take a picture of this slide, please feel free. Um, Again, you can watch the recording for the May 8th program. The link to that recording, I believe might be on the website, but Emily can mention that if where to find it. But July 10th, getting help at home with community resources. In August, path to planning a move. September, exploring end of life options. And October, tending to our grief on the journey of dementia. So exploring loss and discovering meaning. And I'm going to put our the contact information for myself and for Emily Kearns up on the screen. So if you have any questions, you want to reach out to us, please feel free to do so. Take a picture of that. And I'm happy to answer any questions. Again, I hope you walk away with some new information or some information that you can share that may be beneficial to someone that you know who is on the journey.
Can you hear me? Probably not.
Yeah.
Kristi, thanks so much. If we can stop sharing the screen, we'll open up for conversation and discussion. Um, there was one question by Amy earlier, and she's asking in the chat, where are dementia diagnostic centers in Maryland? And Marie responded, Counterpoint Health Service in Columbia is one, and that information's in the chat. Are there others, Kristi, or that you'd like to add to that?
I would like to mention Hopkins, Johns Hopkins, Marine Alzheimer's Treatment Center, I believe is what they go by. And there's also University of Maryland Medical System has a memory loss and dementia treatment center as well. And if anyone wants to throw any others out, please feel free to do so if you want to toss one in the chat.
Thank you. And someone said, can you tell me who is your counterpart in the city? Do you have an Alzheimer's contact in Baltimore City, Kristi?
We do. So I in the city, Marlon Massey is her name. I'm happy to share her information. Or Michelle, if you want to send me an email or call me, I'll give you her information.
Someone is on their iPhone. If you could mute unless you have a question, it would be great
Is
because we
it
can.
me? Is it me that you're hearing?
It is you, yes. Do you have
Okay,
a
I would
question?
like to ask a question.
Please.
But if this is pertinent to it, is there anything that I'm Dory. Hello.
Hi,
Um,
Dory.
and thank you for all this. Is there anything connecting nutrition or MSG in particular to Alzheimer's? And are there any places that you would direct people to understand nutrition better in a way that may not be strictly AMA, but more naturopathically concerned? So,
Kristi, you can start and then I can add if you want. Go ahead.
Yeah, That'd be great. So there is a big connection between, and that's one of the modifiable risk factors that has been identified, nutrition. So a balanced and nutritious diet can play a role in supporting brain health and potentially slowing the progression of Alzheimer's or dementia. Um, studies have shown that certain foods and dietary patterns may be associated with a reduced risk. So we usually recommend the Mind diet is a popular diet that's really good for brain health. So that's a Mediterranean diet. Um, you
Mind
know,
diet,
sorry, go ahead.
are you saying the mind diet is the Mediterranean diet?
Yes.
Okay.
Yep. So that is an excellent option for people who are looking to maybe be a little healthier. It's of course, lowering our processed foods and sugar intake is good for not only our brains but our entire body. So, and I can't speak to the MSG question that you mentioned, but I'll toss it over to Emily if she wants to add anything else about diet and nutrition.
Are you not able to talk about the MSG for any legal reasons or
No,
because?
I just would need to do a little bit more research before I speak on that.
And I will just say MSG connected to the labeling of natural flavors, which is a of MSG that they don't have to any longer say it's MSG, but it is usually just to consider. I'm looking for help with all that. I'm a 24/7 caregiver, and I'm losing my mind. So I did all of that.
I'd like to add, first of all, to respond to what you just said, that you're a caregiver 24/7 and that you're stressing as well, is that on the map, which we didn't talk about, and thank you for this prompt, there is also a tan handrail along the way, and this is really important for self-care. There's a sobering statistic that something like nearly 30% of dementia caregivers get sick or die before their loved ones because of the stress. So check out the handrail on the map because there's also, as Kristi pointed to before, there's a QR code and a link to all the benchmarks and the handrail. So self-care is really important, including nutrition, including rest. A great resource that I've been using in community presentations, it's not the only one. There's a whole proliferation of healthy brain research, which is really exciting. But one person that pulls it together in a very accessible work is Dr. Sanjay Gupta, the CNN health correspondent. He wrote a book called Keep Sharp. Is my Boston accent, Keep Sharp, and a workbook that's wonderful. It's almost like a journal that helps us with our brain health reflections and helps us track what we're doing in terms of his 6 pillars and nutrition like Kristi just said, nutrition is key, and nutrition is his first pillar. But he also talks about movement, walking, for example, a sense of purpose and connection, believe it or not. So we don't think often of the psychological piece related to disease. To me, one of the most important game changers in the research I've seen is that they're saying inflammation is a root cause of our diseases, including brain disease, and the root cause of inflammation is, drum roll, stress. So reducing our stress, which is what he talks a lot about as well. So his book is accessible and at the same time really substantive. He does look at research and quote research, and at the same time, he says, taking baby steps in our life is really important. Also, I want to say Anne Marie added, so I don't know if all of you can see the chat, some of you may not, but she also added Sinai Brain Health in terms of the different dementia diagnostic centers in Maryland. Yeah. Any other questions? Or Kristi, did you want to add further, please? No,
I
to
have a
that one.
question.
Yeah,
Yes.
please, go ahead.
My name is Barbara, and
Hmm.
my sister was diagnosed with dementia in October, and she was living part-time in South Carolina and part-time in Maryland. So we did not notice what was going on until October, and then things just fell apart. We have since moved her back to Maryland, and she is living part-time with me and part-time. She has a house in Prince George's County. I am so overwhelmed. It's considered mild dementia. I have questions about that, but that's what the doctor said. It's mild dementia. Um, Everything is so overwhelming and I've read several books, I've gone to presentations. For example, I went to one yesterday through Johns Hopkins. And unfortunately, many of the services are income-based, and she is not eligible for income-based services. I have called Department of Aging. I can't remember if it was Baltimore County or Prince George's County, but I did call them, and I'm not getting return phone calls. So it's like I don't I don't know where to go. I'm going to try the access point and see if I get any information from there. But it seems like we put out one fire and two more come up. Um, Forgive my disobedient bird. He talking. Um, I just don't know where to go from here. And the stress is just overwhelming. And other than self-care, what suggestion do you have? Should I go through? She will be moving permanently closer to me in Baltimore County, but right now she's just staying with me part-time because she also has a home in Prince George's County. I have tried both counties, but I'm not getting any information.
So first, I'd love to connect with you off of the Zoom so that I can maybe try and help you find some support services for yourself as well. Because as a caregiver, again, self-care and respite for all involved is really important. But it sounds like you haven't tried contacting Maryland Access Point yet, so I would start with that
Okay.
first. And since you're in Baltimore County, I can put that number back in the chat if you need it. But I'd also love
I
to
have
connect.
it. I wrote it down.
Okay. Did you write down my phone number and email?
No.
Okay. I'm gonna put that in the chat for you.
Okay.
And then I'm happy to talk with you about some different opportunities for you as well. And I know, we do have, again, as I mentioned, there are a number of caregiver support groups statewide. There are not only in-person groups, but obviously it can be very hard to leave the person you're caring for, especially when you're caring for them 24/7. So there are also virtual options available for people to call in if they need to call into a support group or join by Zoom. And yes, there's the email for aging information at Baltimore County. Thank you, Ethel, and the Maryland Access Point number. So um,
And
again,
I'm more concerned right now with services for her.
yeah.
I looked at maybe an adult daycare, and most of them are medical daycares, and I don't know that she would qualify for that. And most of them are income based.
Have you tried Town Square in Perry Hall by any chance?
No, the
Okay.
place that I tried was in Parkville, and
Okay.
it is a daycare facility. And then the others that I looked for online were some of them were for younger adults with medical needs, and it's kind of I looked this area and I can't find anything. So then I change courses and I go to another area. But I'm not getting it. I wasn't getting anything concrete that would say, okay, on Monday, Wednesday, and Friday, we can do this. These are some of the services that you can do. The good thing is she is now in Maryland permanently. We did do that. Um, but that's where we are at this point. And you said that's called Town Square in Perry Hall?
Yes. So it's an adult daycare that has kind of unique programming. Um, it's they specialize in dementia care.
I believe I did see that online and I did look at it. And it did have some I think I did look at that, but I will look again, Town Square.
And I want to
Okay.
hop in too and plug a publication. I don't know if you've seen it. There's hard copies and then also it's electronic. You can also find it on our Baltimore County Department of Aging website. It's called Community Resources 2025. And
I
they,
got that from my senior center.
bravo, because they have, and town squares listed, and then there are other adult day programs also. Also in the chat, Anne Marie Real writes, you might benefit from a care, she might benefit from a care manager. So for folks who aren't eligible for some of the referrals that the Maryland Access Point might make, as you're nodding to, as you've seen, a lot of them are income based. Um, they may benefit from a care manager. This is someone you hire. There are different, and these are also listed in Community Resources 2025. Care management's a relatively new sector. Um, Care managers you can hire, you do have to pay, but they also go out and look with and for you for your next steps, for your adult day program or for assisted living, and they vet, the different sites because, as you said, it is exhausting, it is stressful. The care manager is for families with resources, of course. So what we're finding is that is the gap, right? Some folks are eligible for certain subsidized services and then some folks aren't. And so the folks who aren't have to go to the private pay. There's also, by the way, care.com um, has support services for in-home care for a wide range, not only folks living with dementia, but for children. And anyway, so there are other ways of doing it, but call Kristi, let's take this offline and do a deeper dive so that we can get a fuller picture. Kristi, if that's great, you have your contact information, that'd be wonderful. And you can also reach back to um, MAP. If you call Baltimore County Department of Aging MAP office, Maryland Access, you will get a response. So it sounds like you're straddling two different counties, so it's really tricky. But now you have direct contact information
Yeah.
with Kristi, also myself. So let's move on to the next question. But thank you so
Okay.
much, and we hope
Thank
that you
you.
reach back to us. Yeah,
Thank
wonderful.
you.
Thank you. Any other questions or comments for Kristi on this important topic? So glad to see you all here today, engaging and learning for yourself, your clients, your community, your family members. Any other comments or questions? Again, this is being taped and it will be made available on the Baltimore County Department of Aging's YouTube site, along with the first and then future sessions. As Kristi said, this on Thursday, on July 10th, we will have our next session, same time, 11 to 12:30, exploring, how we adjust and find services to support us to stay home as long as possible. So I hope you can all join us for that. It looked like people got in today pretty easily using the Zoom link. So thank you to Ethel and your wonderful communication team for supporting this series and making this so. Um, any last comments, Kristi or others?
One thing to Ethel. Whose face is Ethel? Is that the girl with the long hair? I have not heard an Ethel name in the longest time, and my mother, God rest her soul, was an Ethel. So, are you Ethel?
I'm Ethel. Yes.
Oh my gosh. Hi, Ethel. Anyway,
Nice
a
to meet you.
beautiful name to
Thank
my
you.
heart. Okay. Thank you for all of you. Thank you so much. Really good
Thank you.
advice.
Thanks to those who asked questions and who shared, and to those who were also sharing resources in the chat. We appreciate that. Thank you.
Hello.
Hey.
I'm arriving a little bit late. My apologies. I did think of a question. May I ask a question?
Sure, yes, please go ahead.
Okay. So my question would be if we have a family member and we assuming we're at the early stages and we suspect as family members we're seeing like behavior changes in the individual. Um, this is maybe turning into a very long answer, but what would you recommend as sort of the first steps in a family recognizing that there may be a problem that needs to be cared for?
That's a great question, Steve, and it can be really difficult for anyone to approach that topic. But finding a way to talk to that individual in a way that you as family members and as loved ones feel that they might respond best. You know, everyone may respond differently to that type of discussion, but maybe sitting down in a calm environment with people that they trust and just asking them, have you noticed changes in your memory? And letting them know that you have noticed changes. Um, that sometimes you just have to come out and ask that difficult question or share that what you've noticed. Or if you think that they just would respond horribly to that type of conversation, maybe somebody can offer to go to a primary care appointment with them, to maybe, whether that's share the information with the physician directly, or at least be there to kind of try and help guide a conversation to having a memory evaluation done, to having that baseline cognitive assessment done. I would recommend one of those two directions, depending on how you think that person might respond best. But just
Gotcha.
asking that basic question of have you noticed any concerns in your own memory, can really sometimes break that barrier. And maybe they have, and maybe they're afraid to speak up themselves about it. Because as we talked about, excuse me, it can be really difficult to voice that, and to state that out loud that, I am having some concerns. Um, so they may feel supported in knowing that you're all just feeling the same concern, looking out for them, and that you've noticed as well.
Yeah, do you recommend then as say we have that conversation and then should we just go to their primary care physician next for next
Yes,
steps?
absolutely. Yes. Go to the primary care and share what you've observed, share what those changes have been. And then get their input as far as, do we need to do some diagnostic testing? At least have them do a mental status exam, and get a baseline. That way, you know what steps to take next. But I would definitely recommend an appointment with the primary care to start.
Okay. Okay. Thank you.
You're welcome.
Nice to meet you all.
Thanks for joining, Steve. Any other questions?
Well, if there's no other questions, I think we'll wrap up. And Kristi, we want to thank you so much for being our key presenter today and for being on the leadership team throughout the Dementia Friendly Baltimore County. So kudos to you and to the Alzheimer's Association for being a key partner in all that we do in this wonderful initiative. A shout out again to the BCDA communications team for supporting this series. And again, join us next month on July 10th, same time, 11 to 12:30. And if you want hard copies of the map or if you want electronic copy of the map, reach out to me. I'm at Dementia Friendly at baltimorecountymd.gov. And reach out to Kristi, the Alzheimer's Association. You can reach out to her directly or the 24/7 helpline for more information. We wish you a great day and thank you for joining. Take care.